Across the country, states and cities are lifting mandates. Businesses bringing workers back to offices. Even some of the strictest local leaders are now saying it's time to start living with COVID, especially as the Omicron surge fades. Right now, about 53,000 Americans are in hospitals sick with COVID. HHS reports that's a 65% drop from a month ago. And deaths are thankfully also down. Data shows we're now averaging still 1,800 deaths a day, but a 27% decrease over the past 2 weeks. Americans may be moving on from the pandemic, but many are still asking, when will we need another COVID shot? A recent analysis from the New York Times suggests most people may not need another vaccine dose for several months or even years. Apurva Mandavelli now. She covers science and global health for the Times. She's the Times reporter behind this new analysis. Apurva, great to see you. What are these recent studies telling us about how well the vaccines are holding up?
This is the question that's been on everybody's mind, right? Is whether we will need boosters and vaccines for the foreseeable future. What's in store for us? And what these studies that I looked at are telling us is that, as you mentioned, we will probably not need a booster for many months if we've already had 2 doses, and especially if you've had 3. And that's coming from not 1 or 2 studies, but at least 8 studies that I looked at, and many more out there that I didn't even get a chance to look at.
Well, it's great news to read. Your article focuses a lot on T cells. Why are experts convinced now, or seem to be, that these cells could help us fight future variants?
You know, immunologists have always known this, that even though we've all been focused on antibodies, T cells and another set of cells called B cells are really the ones that are going to protect us long term. And what they've shown is that these T cells, you know, they are the soldiers that sort of wait around. They remember what the virus looks like. And they may not prevent infection, but once the virus gets in your body, they're aroused pretty quickly and they come up and get rid of any infected cell. And so these studies are showing us that T cells are actually quite robust and able to protect us from any variant of the virus, including Omicron. In the studies that I looked at, the T cells looked like they were about 80% effective against Omicron. So that was very good news.
That is. After all your research, are you more optimistic about the outcome of the next variant?
I am, because, you know, we were just talking about T cells, but even the antibodies, what the studies I looked at were showing is that, you know, the antibodies, the cells that make the antibodies get better and better over time. And so the longer we go from when we first had the vaccines, the better our immune systems will be and the better they will be at recognizing future variants. So it does seem like even if the new variant comes along, we should be in fairly good shape.
Love to hear it. Apurva Mandavelli, thank you.